My name is Tonya Myles, and I'm a general manager of Cairde. And on behalf of Cairde, our team of staff and volunteers and participants, I want to warmly welcome you today to the launch of our report, Improving Mental Health Engagement for Migrant and Ethnic Minority Women. And before we begin, I would like to acknowledge the organizations that made this project possible. First of all, we're very grateful to the HC Office of Mental Health Engagement and Recovery for their partnership and support, and to the Department of Health for funding this work. We're really pleased to see such a broad mix of people here today, from community organizations, from mental health services, policymakers, researchers, and crucially, people with lived experience. And this mix reflects exactly what this project is about. For those who may not know us, Cairde is a national community development and health organization, and we work to reduce health inequalities experienced by migrant and ethnic minority communities in Ireland. Our work focuses on three core areas. First one is support and advocacy. Second one is capacity building and training. And third is working with services to improve how they engage with diverse communities. A central principle of our work is that lived experience is not an add-on. It is very crucial. It is expertise. And unless systems are designed in ways that genuinely include those voices, inequalities don't just persist, they deepen. This project emerged from a very clear persistent gap. At the policy level in Ireland, there is a strong and welcome commitment to mental health engagement and to involving people with lived experience in shaping the services. But what we continue to see, and what migrant and ethnic minority communities tell us repeatedly in our work on the ground, is that they remain largely absent from those engagement spaces. Not because of lack of interest inside or capacity, but because of structural barriers. And I'm sure that many of you know these barriers are such as limited access to information about how engagement works. It's a language and cultural barriers. Some people have lack of trust in the systems. Participation can be greatly diminished by very physical issues. It's unpaid or unsupported participation. And engagement spaces sometimes are simply not designed with migrant and ethnic community in mind. As a result, many people told us they were asked to share their stories, but not to shape the decisions. They were present, but not influential, invited, but not supported. And that's the inequity this work is sets out to address. And I suppose what this project did differently, this initiative brought together Cairde, HEC Mental Health Engagement and Recovery Office, and the CHUMS Research Collective in Dublin City University. And we all had this shared commitment to doing things differently. Rather than starting with the structures and fitting people into them, this project started with capacity, trust, and lived experience, and asked, what would meaningful engagement actually need to look like for migrant and ethnic minority communities? So this project had two connected phases. First, a capacity building training program focused on mental health system literacy, advocacy skills, and confidence to participate in engagement spaces, delivered with wraparound supports like childcare, travel cost, and peer support. And second, a participatory research phase where people could reflect on their experiences of engagement, the barriers they face, and what genuinely inclusive engagement structures would require. And crucially, it wasn't research on community, it was research with communities. So why today matters for us? What this report shows very clearly is that mental health engagement is not a single moment, or it's not a committee seat. It is a continuum from awareness and trust building to supported participation to real influence in decision making. It also shows that community organizations are not peripheral to engagement. They're actually structural to it. They're trusted spaces, they're bridges, and without them, engagement simply does not reach many people at all. Today's launch is not just about sharing findings. It marks an important step towards a new mental health engagement structure for migrant and ethnic minorities. And the structure that grounded in equity, cultural responsiveness, and lived experience from the start. So I want to close by acknowledging the people who shared their time, their insights, and often very, very personal experiences through this project. This work exists because of their generosity. They absolutely were central to this project. And we, all of us, carry responsibility to act on what they have told us. Thank you again for being here and for being part of this conversation. And now I want to pass the mic, or imaginary mic, to Una Twomey from HSE Mental Health Engagement and Recovery Office. Thank you.
Thank you, Tonya, and afternoon, everyone. It's great to see some familiar faces on the screen. My name is Una Twomey, and I'm the strategy lead for mental health engagement and recovery. And thank you, Tonya, for such a warm welcome. I suppose listening to the overview there, what's clear is how this project has promoted a recovery-orientated approach and has clearly centred the voice of lived experience for meaningful engagement. Again, I just want to acknowledge the work of yourselves, Cairde, the CHUMS team, and importantly, again, the women who have contributed their time and their expertise. Again, I think you had highlighted this as well, Tonya, in the opening, that these insights have highlighted the structural barriers that continue to sometimes limit participation, but they've also highlighted the supports that are required to ensure engagement is genuine and inclusive. From our perspective in mental health engagement and recovery, this work reflects exactly the kind of partnership and community-led approach that we support. It also reinforces that engagement, as you said, isn't a single event, but it's a supported pathway towards real influence in decision-making, and how vital it is to embed the voice of lived experience into both the design, the development, and the delivery of services. I also want to thank Jacopo, I see you on the screen. So Jacopo Villani, who in his previous role with our office, Mental Health Engagement Recovery, brought people together for this initiative, and it's that collaboration like that that has strengthened our engagement structures. So I'm looking forward to today's presentations and discussions, but more importantly, how we in mental health engagement and recovery can move forward to continuing this work together to ensure that migrant and ethnic minority women are not only included in engagement structures, but are truly influential in them as well. So thank you, Tonya. I might pass over the mic back to yourself, I think.
Thank you very much, Una. It's great to see you here and to see the commitment. And I suppose at the next, I I'm forwarding the mic to Zahra Farahani from DCU CHUMS project, who is going to tell us more about how this project has been delivered.
Hi, everybody. Thank you so much, Tonya, for the introduction. So I first start sharing my slides so that I make sure that things works well and are smoothly set up. So my name is Zahra Farahani. I'm the postdoc researcher on the CHUMS study. I'm here with my colleagues, Dr. Becca Murphy, the principal investigator of the CHUMS, as well as Yukti Arora and Ethel Matarazza, our colleagues in CHUMS. So I'll be kind of explaining a little bit about the process and the findings of the research that we did in collaboration with Cairde. So we called it Improving Mental Health Engagement for Migrant and Ethnic Minoritized Women, Key Findings and Pathways for More Inclusive Mental Health Engagement. So I guess more inclusive and equitable. So what we know already about mental health engagement from evidence and policy, like to really briefly touch on that, and Tonya talked about that in more detail, is that we know that lived experience is recognized as a very essential part of improving mental health systems. And we also know that meaningful mental health engagement is a core principle in Irish policy right now. So it's been several years that there's been a huge emphasis on this. Examples are sharing the vision and HSE mental health engagement framework. But what do we really mean about when we talk about mental health engagement? This is really important. So by mental health engagement, we mean a respectful, dignified, and equitable process that recognizes lived experience as expertise and enables meaningful influence on decision-making. So this definition comes right from the HSE mental health engagement framework. So what it says, in essence, is that we need to go beyond consultation to be able to do meaningful involvement. And mental health engagement requires safety, trust, and support, and it is central to service design and improvement. So this is what we have in principle. But we also know that engagement has not been equitable across all communities. I think Tonya talked about this in details, so I'm not going to repeat that, but just to briefly touch. And migrant and ethnic minoritized women remain underrepresented within the engagement frameworks, and their lived experience is less likely to shape decision-making. So this brings us right to the aim of this research. So in collaboration with Cairde and along and in parallel with the training, capacity building training that was running, this study aimed to understand what does mental health engagement mean to ethnic minoritized women to start off with, and how they view these structures that we think that we kind of have them open to everybody. And also we were interested to identify barriers and facilitators to engagement and ways to enhance their participation and engagement. We also were interested to know the training, the capacity building training that was delivered with Cairde, how that's kind of more than an evaluation, kind of reflect a little bit on that experience, and also use the research as a platform to explore women's perspective on improving mental health services for their communities. So instead of like just focusing on engagement, we kind of went a little bit further, not very deep, but at the level that was possible as part of the focus groups to really hear what our participants think about the improvement of services. So this was our first step in terms of, I suppose, actualizing the new engagement forum. So in terms of method, in collaboration with Cairde, we recruited participants to conduct 6 focus groups. So I have to emphasize on the role of Cairde in terms of the recruitment, specifically, because that's huge to be able to recruit 33 people in such a short time, and this would have not been possible without the role of Cairde and the way that they are connected with the community. So we had 6 focus groups between March and May 2025. We tried to conduct the focus groups in a culturally responsive way to amplify migrant women's voices. Our participants were migrant and ethnic minoritized women aged between 25 and 64 from 15 plus countries, and around 90% of them reported personal or family mental health experience. And session held online and in person at Cairde offices depends on the convenience for our participants. I really would like to kind of flag one particular focus group that we had with ethnic minoritized women who also had a professional role in mental health and mostly in mental health organizations. Some of the insight comes from those groups. So in a way, they had their own lived experience as well as their professional experience here. So in terms of the research findings, here is how we summarized our research findings. So the main part of our findings related to mental health engagement in terms of how mental health engagement has been conceptualized by ethnic minoritized women, as well as the important factors and strategies in mental health engagement. We also have some findings in terms of service improvement, although we really would like to emphasize on the fact that this is just the beginning of looking into service improvement. This is by no means, this is going to be a very comprehensive way of making recommendation for service improvement. Therefore, our recommendations will be focused only on the mental health engagement aspect. But this was a very successful starting point, in fact, to provide a platform for ethnic minoritized women to talk about service improvement. So what we learned was that from their point of view, it's very important for services to be person-centered, so providing person-centered care based on the needs and situation of every person and individual. It's very important for the services to be culturally responsive, and also access was a big thing. So the services needs to be more accessible to this cohort. But of course, I'm not going to go into details of this part. This is a very important topic that we in CHUMS we are trying to look into it in more depth and breadth. Also, I know that other research are conducting. Also, the aim of this platform, in fact, is to enhance more input from ethnic minoritized women in terms of service improvement. Then we had reflection on the mental health engagement training, the capacity building training that Cairde delivered. So we had, but mostly positive. Like I have to say, like the feedback was very, very positive. Also to mention that none of the Cairde staff were there at the time when we were talking to participants about their experience of the training, and that's important. But participants found this training as a way to connect with others, with other peers and other women in their communities or in other communities, people who have more in common with. This was a great opportunity for them to kind of gain more awareness and understanding of the mental health system in Ireland. But then on the other side of it, it would have been more helpful if there was more, like the limited number of sessions, and if it was continuous and sustained. And also there are some language barriers and mostly in terms of not that people are at the level of English to be able to communicate and talk and understand, but then there is this awareness of the fact that someone who is not a native speaker of English might have other needs, and we might need to kind of slow down a little bit or avoid some terminologies, etc. So I leave this at there, and I kind of move to the main findings that is the main focus of my presentation today in terms of mental health engagement. So the first, and I suppose the key finding of this research is how ethnic minoritized women and our participants conceptualize mental health engagements. I know that Emilia will be talking about this in more detail when I finish this presentation. So I'm going to touch on this, but this is really the key to everything that we learned here. So mental health engagement exists on a spectrum when we talk about ethnic minoritized women. It starts from awareness to advocacy. It's a journey, not just participation. It starts with understanding mental health as a term or as a concept, and involves learning about support and access that is available. It sometimes manifests itself in helping ourselves and our families. And for some participants, it may go beyond that to be applied to use of services, for to be able to talk about it with others and having a voice and driving change. So I'm kind of reassured that Emilia is going to talk about this more. So I'm not going to go into details of it, but just to flag that this is a really important matter. So the way that we conceptualize mental health engagement as perhaps participation in a meeting or in a committee, or answering a survey, or participating in a focus group, etc., it does not manifest itself with ethnic minoritized women. You have to really change our lens and look at it in a different way. Then comes the important factors and strategies for mental health engagement. So this diagram kind of summarizes our findings. So as you can see, important factors are understanding the mental health system, the environmental factors, trust, social factors or social determinants of mental health, and cultural language, and equality and inclusion. So I'm going to go through all of them one by one, hopefully fast enough so that I'm not running out of time. So understanding the mental health system is really, really important for people to be able to start engaging. So it is very hard to navigate Irish mental health services for someone who is an outsider, who hasn't been through the system before. Again, in some cultures, mental health isn't openly recognized as a phenomenon, in fact, and that's something that needs to be addressed and acknowledged. And understanding the system is a major challenge for many of our participants. And in terms of suggestions, of course, they suggested awareness campaign, training and social media outreach, called for long-term efforts to build understanding and trust, not just ad hoc, single segmented trainings or initiatives. In terms of cultural language barriers reduce communication and confidence. So people are finding it hard to communicate their experience, but they also don't have the confidence to talk about their experience because they perceive themselves as not being fluent enough. It leads to isolation and avoidance of community spaces at a more general level, higher level. It's very hard to express emotions in another language. And of course, when you want to engage in mental health structures, inevitably you have to talk about your emotional experiences sometimes. And mental health is being seen differently or negatively across cultures. And the negative aspect of it would means that in a lot of communities there is there's stigma around mental health, meaning that if someone from an ethnic minoritized community start engaging with mental health structures, they're taking a risk of being stigmatized by their own communities. So that is somehow a cultural barrier, in fact. And cultural and gender norms sometimes limit participation for some communities, or some women in communities. So their role of kind of being responsible to live to the norm of their families, or to protect the male member of the family because they are the lead. Or so these are the cultural aspects. So the suggestions are to use translated materials and interpreters, hire bilingual ethnic minority staff in services, and adopt flexible, culturally aware engagement approaches. So I guess there's more detailed element of these approaches as part of the report that you can refer to. Trust came up quite often in almost by every single participant. So there is a fear and confidentiality concerns that limits openness. That's kind of confidentiality about the person's privacy, but also not trusting this the mental health system in general. Then there is a stigma within families and communities that reinforces silence, that I talked about that. And also the discrimination that ethnic minoritized women experience on a day-to-day basis reduces confidence to seek help. Also, those could be experiences of them when they want to engage with mental health structures. Also, trust builds slowly through community relationships, and we can't expect it to be there over the night. So the suggestions are to partner with community organizations. I think that's the second key finding of this research. Use cultural and social gatherings as a safe space. So in terms of inviting, instead of inviting, I think, minoritized women to our own spaces, what about us going to them, knocking their door, kind of trying to approach them in a space that is safe and comfortable for them. Also, to promote person-centered care through listening and respect. So listening and respect came up a lot, and in fact, it's the cornerstone of building trust, to listen carefully and actively and empathically, and to respect people. Then we have the environmental factors. We know that ethnic minorities women, like everyone else, they have limited time, they have work commitment, they need childcare, they have limitation in terms of travel. But these challenges are often overlooked or unsupported, like they're not being talked about sometimes. And engaging with ethnic minoritized women meaningfully requires resources and flexibility. So that's the bottom line. Like, we need resources, and we need to be able to show flexibility if we really want to accommodate participation and involvement. So the suggestions from our participants was compensation for lived experience input, support for childcare and travel costs, funding community organizations to lead engagement. Then we have the social factors, or what we would often call social determinants of mental health. But this here, it's not just about the mental health. So the same determinants that would contribute to mental health of everybody, including ethnic minoritized women, also contribute to their mental health engagement with mental health services in a broader way. When someone has issues with housing, they're looking for a job, and their immigration status is not clear, or it's not definite, they experience racism on a daily basis, that would really limit their capacity for engagement. Poor living conditions and financial stress increases this stress, which would subsequently limit ethnic minorities women's capacity to be able to even be in a headspace to talk or to go through their experiences one more time with us, or to be able to engage. Also, everyday racism leads to isolation and reluctance to seek help, which would obviously limit mental health engagement at a very broader level. So in terms of suggestions, our participants suggested that basic needs must be met first for real engagement. So we cannot just invite someone to talk about their experience without knowing what they really need in terms of basics. What are the things that they're struggling with right now? And then there is a call for individualized responsive support and reciprocal relationship that builds trust. So it's all about the type of work that is happening in Cairde and other community mental health services. I think I'm getting a message in terms of the time, so I better speed that up. And then the last is equality and inclusion. So participants who had experience of engagement with mental health structures, they believe that lived experience is often undervalued, and participants felt their voice carried less weight than professionals. And this is something that again needs to be addressed through capacity building and ongoing support, and increasing the representation of the migrant and ethnic minoritized women. Okay, so to conclude, barriers are limited understanding of mental health system, cultural and linguistic barriers, mistrust of mental health services and institutions, and socio-environmental constraints, and the lived experience not consistently valued or acted upon. Strategies: establish a shared, culturally grounded understanding of mental health engagement, use responsive and flexible engagement methodologies, institutionalize equity measures such as recognition, remuneration, and anti-tokenism, and invest in sustained partnership with community organizations. So that's it in terms of the findings. I know that I went over the time. Here is the outline of the chapters of the report. So we talked about the context and policy background in chapter 1, then capacity building training as explained in chapter 2, and chapter 3 is fully dedicated to the research, and chapter 4 is the recommendations and pathways for more equitable engagement. Thank you so much for listening to me. The report will be available online after this launch. That's it. That's me. Thank you so much.
Thank you very much, Zahra, for a very comprehensive presentation. And we will have a little time at the end of this today's event for people to ask questions. But we have another part to listen to before we, actually another 2 parts before we have allocated time for questions. And just to say that we will follow up with all of you individually to make sure that you know where to get the full version of the report. Thank you very much, Zahra, for everything. So now I'm going to give the mic to Cleide Regina Olivera, who is going to do a little introduction to the next part of our day, of our morning. And Cleide is a project participant, and she was involved in this research. So now over to you, please.
Hello, good afternoon, you all. Thank you for having me. It's a great opportunity to be here. So when we were participants of this research, and then when the research was presented by Zahra team, by Dr. Zahra and the team, they invited us to give those recommendations as well. So as a participant and member of the ethnic minority in Ireland. So we discussed among us how or who was going to be responsible to bring up this information to this meeting. So everybody was quite eager to come here and tell their own stories and bring the stories and bring the recommendation. So because of the restraints of time, we together we decide to compile all this information in a form that in very inclusive form that everybody could work together. So it happens that I'm also a visual artist, and I suggested let's do a video, and everybody wanted to participate. So Emilia, Dalao, and Waf and the team, we got together with all the participants that could be available to personal meetings or Zoom calls or Zoom meetings, and we decided to make a compilation of those recommendations. So this video basically will show what Dr. Zahra was basically an illustration of what Dr. Zahra was telling about the research. It comes from the conceptualization of what is mental health engagement, and describe as well the journey from this understanding until the moment that you start to drive change for yourself and to your whole family. So you're gonna have pieces of stories for living experiences, people that participate in the project, and people that are here in this afternoon watching us. And in the end, we will have some recommendations and suggestions of how to make it mental health engagement more equitable. And we finalize the video with an invitation for us to work together with, for example, with structures that is already available, such as with organizations such as Cairde. So I hope you enjoyed the video and listened carefully to the voices, and I'm very glad to work with you all. It was a pathway of learning. So thank you so much for having us here.
Well, can you upload the video, please? Something I didn't know how to look after myself, or maybe the way, helped me to cope with different challenges in life. So until I joined the training and I started to know, become fully aware what's mental health mean. So I think it's really important to find places like here, help the migrants. Exactly. So, when we work with our community, Arab and Muslim, this is the big issue. When you meet the people and you ask to talk about what is mental health? When we have meetings from Arab and Muslim, and then we do it like coffee morning, like that, and we track for us, and they know what is mental health now. And you encourage the people to speak, and if they have some problem, you can come to you and ask you for that. Because of that, we are so happy for that, because we do something for the community, for the people.
What became apparent that for migrants, mental health engagement is a term that it's not really well known, and it can be seen on a spectrum. For some people, it starts from having a basic mental health awareness from those communities that don't really talk about mental health as much. And in the migrant context, it's moving towards knowing what supports are available, having strategies, healthcare strategies, then knowing how to engage with mental health services, and that mental health engagement bit, so having a voice in mental health service delivery, and then our meaningful contribution to mental health services improvement is really at the end of the spectrum.
I didn't know anything about mental health because the stigma has shadowed the understanding of mental health until I came to Cairde and I had the understanding what is it that is when you are talking about mental health in such a way that even today I am able to guide my own son to know what is it, how do you take care of yourself. Yet I had mental health issues because of my experience, because of my hardshipness, because of what I went through.
it's actually long story of each person's, and I think the honesty and strongly and truly say from your heart your experience, your knowledge, how you face the services, what is working, what's not working, what is good for us, what is not good, what has to be changed, and that's very important. And I'm delighted that all departments and HSE would like to hear our voice and taking seriously and welcoming and for the project.
Yeah.
Thanks.
Yeah.
Thank you.
In my opinion and in my perception, maybe the 90% of the Roma women I know, they have some level of depression, but they normalize it like it's something normal in their lives. So if we can change this mentality involving in mental health topics, it's gonna be a big change.
So, as a migrant in Ireland, I discovered something. The stress of being a migrant, of being a minority entity is terrible. Depression begins to cripple. Anxieties begin to skitter into one's mind. And how do you cope? There are systems in place, institutions in place, the mental health institution, there to help you with psychiatrists and psychologists and counselors. And then you want to interact with this institution. What do you meet there as a minority man? A condescending, patronizing attitude. And then instead of going to suffer such things, what do? Prepare to keep yourself.
If you are being stigmatized, you have fear, you will not be able to express yourself boldly and openly and digitally. When they give you that confidence, you build that trust. You tell them, you express yourself without being afraid that you'll be intimidated. Like back in my place, people from sub-Saharan Africa, most of us are being stigmatized, particularly as concerns mental health education, because we believe that mental health is something spiritual, it's a curse, it's a taboo.
Just if you don't know people's cultures, you end up judging them wrongly. You don't understand them. If you know people's cultures, you can able to help that person and understand them. And also language based, most important thing.
In my opinion, capacity and confidence, it's something, it doesn't come just like that. It takes time to build up. And people often begin to engage when they feel it's a safe space and their voice is being heard.
They lived so hard conditions in Ukraine, and they can't explain somebody who was not in this condition how it feels.
A lot of them have a story of being pathologized, of being misunderstood, of being insulted and abused. So all those things, the burden of it becomes heavy. How to go about it? How do we resolve this issue? I know to talk to people. I'm an English speaker, but when you listen to my accent, it's thick, it's Africanic, Nigerianic. So at times when I'm talking to people, they say, I beg your pardon. Oh, can you call it?
It is very difficult for our Roma community to trust anymore the system, because in the past they have no forgetting what happened to the whole generation during the Holocaust. Discrimination healthcare system is very huge. They feel very discriminated, and this make Roma people stop getting involving and asking for help.
It's better to talk face to face about mental health and see how people really are in their homes. Some people don't say anything. And talk to them and
Talk for these people, and they feel scared. They feel, what can I do? Because they didn't know what exactly happened. But when they explain and encourage them, it is something benefit for you. If you share your experience, the people heard your voice and know what exactly you want. And then this is something you build the trust and encourage the people to share experience.
Yes. Organization, the community organization like Cairde plays a huge role in supporting people from ethnic minorities or different backgrounds, because basically I feel from working with and supporting people, they kind of give me that feeling that they found the place where they belong to. There's some similarity. There is no judgment. It's comfortable. That's why they are reaching out.
Project could be the wing for the people, could be the voice for the people to make even HRC understand better, because HRC might not even understand better how the people need the services.
So what kind of gives you that confidence to start contributing, in those conversations in an informed and confident way?
Yeah, because the simple answer is because I want things to be changed. If I've been through something, or I've witnessed someone going through something like mental health breakdown or challenge, I don't want that to happen for other people as well.
What makes me to be able to speak up when I'm in these meetings? We engage, I tell them exactly where I'm coming from, what is the problems, what is going on, what we need, and what support we need to be support. When they need to be support, especially people like me, we need the support in what we're going through, and what can be solved. What can we solve with these problems? So it makes me easy to speak to those people exactly what is going on, tell them the truth.
We are advocating, and we can bring the pain of the migrants.
How the HSC should work together with us to implement the mental health policy for all.
Mental health institution needs to help us by hiring interpreters, not just interpreters, also hiring mental health experts who are from other minorities.
Interpreter is not enough job to do this kind of job in this context. This context should be better to be intercultural mediator, would mean one person fully trained, and to treat the context in holistic way. So to see the patient as a person.
What we need most of all is professional counseling, professional help. So it's better for a time for the mental institution to meet us at those points where we go to sit, at the barber shop where we go to gossip, at some of the drinking places where we go to share our problems. Meet us at those points. The issue of trust is also taken care of, because then you are meeting us on our own terms.
Employ more peer supporters, peer advocates from different backgrounds.
Services don't always fit Roma culture and language. And staff for any service provider must be use clear words and not to speak in political terms with the Roma. Work with Roma representative to building trust. The staff any service provider to use clear and simple languages. Training the staff about Roma culture and tradition is the key to building trust. By sharing a video featuring with the Roma community can help service provider understand their experience and needs better.
I believe that we could work in a transcultural commission, so we can work together in different projects. So the transcultural commission is of course people from any language, people for living experience, and also people that have access to other people from that certain language or that certain culture. And after when I started the courses, I was talking and I said everything what problem I have. Because also myself I was feeling shame. I feeling like somebody he speaks so bad about me if I said my stories and my problems I have. But that's I think so it's very helpful if you organize it, you, the Louth and Mariana, one day to do big group about mental health.
We need to have some type of meetings and just to show different problems in a system, because this is a risk, this is a loss, this is overwhelming, and this is a second traumatization. And just to take care about this, because we know our culture systems and the stakeholders know how to fix it. And we just show them this systems problem.
I noticed that the recognition and encouragement are very important. For many women, being listened, congratulate them for completing the training, and acknowledge their contributions. This recognition creates a safe space and made them feel valued.
Many thanks for our very inspiring participants, volunteers, and I hope the words and the suggestions have resonated with many of you. I just wanted to say very big thank you to them being integral and central part of any work that we do on mental health. And now I'm conscious of the time, so I'm going to pass the microphone to Emilia. Emilia Marchelewska, who is our mental health lead in Cairde, whom you probably all know. So Emilia, now I'm giving the stage to you.
Thank you very much, Tonya. I'm thrilled to be here today because I had a power cut this morning and I was afraid that I might not be here, but I am. And I have to say, at least to me, it feels like a very rich morning. It feels like a celebration of the work that we have done so far. And at the same time, the readiness to make the next step on this mental health engagement journey. Let me share now a short presentation. I will fly through it so we have time to for a short discussion. During the video, you may have heard people referring to different bits and pieces of work that we've done together at Cairde as part of our mental health initiative that aims to improve mental health inequalities. So we've piloted few projects, and we would love to develop and sustain the three parts of the project, which involve support, peer support and advocacy in mental health and well-being, a community-based mental health promotion and capacity building, and of course the amplification of the lived experience voices through the structure that we are discussing today. This work is really linked or build on the previous body of work that we've been doing at Cairde. We've always centered our work on the lived experience ethos, and advocacy is at its core. So when we developed this mental health advocacy and support for ethnic minorities, we hope that apart from individual support, we will also create a meaningful pathways for migrants and ethnic minorities to influence mental health services. And I'm delighted that this is happening, and I'm really grateful for the people that we have worked, people who have lived experience that we have worked over the years, and for HSE Mental Health Recovery and Engagement Office to start working with this. With us to enhance mental health and engagement for migrant and ethnic minorities. What we are really trying to achieve through this structure is to empower migrant and ethnic minorities who have used mental health services or who need mental health services to advocate for better access for themselves and for their peers. We hope to facilitate people's participation in service improvement working groups to drive positive change in mental health services, and also to enhance their mental health and recovery outcomes. For the mental health services, we hope that they will gain a deeper understanding of the lived experience of migrants and ethnic minorities, and this will lead to improved inclusivity of mental health services, so they can better cater to the needs of diverse populations, and we hope to pass on concrete and feasible and practical recommendations to the key stakeholders. So whom are we involving in this migrant and ethnic minority mental health engagement structure? We are open to, we're inviting people from migrant and ethnic minority backgrounds who experience or have experienced mental health challenges, have used mental health services, their families, family members, carers and supporters. Through the work to date, our kind of joint experience, and thanks to the findings of the research that we're so lucky to be involved with the CHUMS study group. We certain elements of this engagement structures have became apparent. So one of them is a community, an open space, creating a community which is an open space for people to feel that they belong, where they can share, learn, and identify system gaps and shape ideas. Because at Cairde we apply community development approach. So our purpose and goal is to build people's capacity via training, peer learning, and collective reflection. And it's important, as you've heard today, it's important to take time to build trust, connection, and confidence in an environment that feels culturally safe. And this approach also supports individuals who are already involved in mental health engagement opportunities to kind of broaden their experiences and be exposed to stories experienced by other participants. It's also an opportunity to mobilize new members and to be flexible because, as you've heard, sometimes you need to go out to where people are and maybe organize meetings in people's languages. And of course, central to this work is that one-on-one support for people who are participating in mental health engagement structures or activities. So for example, we nominate people for various, to participate on various structures. And we try to ensure their meaningful engagement, that they are supported and they can sustain their participations. So for example, we work with individuals who are on the NEMIC reference group or lived experience panel to take part in research. The last two parts is really, I think, what you are most interested in as the key stakeholders. We have worked in a kind of more focused way, task and project-based groups with focused work streams to develop solutions and to collaborate with services, maybe to co-produce recommendations, tools, or policies. So, for example, with this group now, we have been involving those with self-experience of related to suicide to develop submission for the new Connecting for Life policy. We've met, for example, with Mental Health Commission regarding interpretation and their translation resources, and we felt that was really valuable time and very and valuable for both sides' way of working together. But I think the crucial part is to step up from this into this forum that is system level engagement. I think this is the point that you've heard from the participants in the video, that people are really ready for that, to have a structured space that brings together the key stakeholders and the migrant community representatives to influence policy and design. And it's in a similar way in which the local mental health engagement fora are run. It needs to be sustainable. There needs to be a formal channel for influence and agreed communication and feedback structures to ensure that the migrant voices shape decisions on the system level. As mentioned already, the report and the video will be available on our website, cairde.ie. And for everyone, well, we'd love to invite everyone maybe to get in touch with us. You can link up with myself to start up the conversation. But for the sake of today, I would like to invite everyone for a short discussion. Any comments, any questions, any proposals that you may have to strengthen mental health engagement with migrants and ethnic minorities, how we can work together to ensure meaningful engagement.
If there is no further questions, I would like to move to the close of our launch of our morning event. And I would like to pass the mic to Michael Gibbons, who is engaged with us in a kind of more governance capacity, our board member, but also is directly working with people on a front line. Michael?
Thanks, Tonya. And I promise it's great to see so many familiar faces. I promise I'll keep this short and sweet because I know it's lunchtime and people are probably hungry. But I just want to start by saying thank you for the opportunity to offer a few kind of closing reflections on today. I suppose I'm coming at this as somebody who works in mental health for the past kind of 30 years and as somebody who sits on the board of Cairde. So in a way, I also kind of bring a lived experience from the services kind of perspective, being close to the systems and to the realities of how services actually work on the ground gives you a particular insight, I suppose, into what helps people engage and what can unintentionally kind of get in the way sometimes. And kind of watching the video, that sort of really kind of resonated with me. So given the focus of the study, it's hard not to kind of recognize how significant an unmet need this continues to be. So for my work, it's actually reassuring to see how closely the findings of the research study align with what's been experienced on the ground, not because the need isn't kind of serious, but because it tells us that what's documented kind of here reflects real kind of lived realities. So while the study quite rightly centres on migrant and ethnic minority kind of women, it also invites us to reflect more broadly, without wanting to generalise. Many of the barriers and the facilitators highlighted here, kind of around trust and access and language and navigating kind of systems, resonates with the wider migrant community as well. So one of the things I find particularly helpful around this work is how it frames mental health engagement. Rather than seeing it as a single kind of action or endpoint, It positions engagement as a continuum where early awareness and mental health kind of literacy through understanding, support and services, and ultimately having a voice in governance and decision making. So from my perspective as a mental health practitioner, working closely with services, that framing is really, really important. It helps locate where people are on their journey, and it reminds us that not everybody is starting at the same place or moving at the same pace. This research also makes clear that the barriers to engagement are complex, they're quite layered, and they're deeply embedded. So addressing them isn't about a quick fix. It requires sustained commitment, proper resourcing, and critically listening to the strategies that women themselves identify as meaningful and effective. Again and again, we're learning that when initiatives are designed with people rather than for them, when there's flexibility, when there's trust, when there's room for shared learning, engagement deepens and becomes really sustainable. What also comes across strongly is the central role of community organisations like Cairde, who I'm really proud to be associated with. They're not just a bridge into services, they're a place where trust is built, confidence develops, and people begin to see themselves as having a voice within the system. So rather than asking how we get communities to engage, this work kind of gently turns the question back to us: how ready are the systems to receive that engagement? So I want to finish by congratulating everybody involved in the project. The depth, the care, the integrity of the work really shows, not just in the findings, but in how the voices of the women are centred and respected throughout. This is research that doesn't just describe a problem, it offers a thoughtful and grounded pathway forward. So thank you.
Thank you very much, Michael. Sorry, I just lost my unmute button for a second. And I would like to close the date and close the event, and rather for us. And I would like to thank you, everybody, for participating and for being here. And I would like to thank all our wonderful partners. This is kind of our first direct engagement with the Mental Health Engagement Recovery Office, and it was very, very positive experience. And we're hoping that we will continue and take this work to the next level. Thank you very much, everybody.
Thanks all.
Thank you, Tonya. Thank you, everyone.
Yep.
Thank you.
Bye.
Well done. Congratulations.
Thank you, everybody. Thank you.